Hello and welcome back to another video. In this lesson, we are going to look at medicine's speaking sample task 2. So stay tuned with me till the end because in this video, we are going to look at how to prepare for the task and we will also discuss on the task so that you can communicate effectively. So first of all, let me tell you that this is your card, that means this is doctor's card. And the upper one is my card, that is interlocutor's card. Now, on the test day, you will be given only your card to prepare and communicate. You will have 3 minutes of preparation time and 5 minutes for communication. Make sure that this is a two-way communication that you should maintain. So, first of all, when the interlocutor gives you the card, you should look at the setting. In this case, the setting is local clinic. Now start imagine yourself working in a local clinic, okay? In any clinic that you might have worked in, and you can just imagine that you are there. Now let's read the patient's background and try to understand that what kind of patient is allocated to us. So in this case, you see the parent of a 5-year-old boy who was diagnosed with asthma a couple of days ago. After attending the emergency department with a severe bout of coughing, breathing difficulty, and wheezing. This is a follow-up appointment. The child is not present for the discussion. So here you can underline the keywords even on the test day. So here you can see that you are not talking to the patient directly, you are talking to the parent. And your patient is a 5-year-old boy. Okay, so now start imagination. Like if your interlocutor is male, consider that you are talking to the this boy's father. If your interlocutor is female, like in my case, you can consider me as mother of your patient. Okay, so imagine a mother with 5-year-old boy so that you will not make an error of he or she. Now, in this case, he was diagnosed with asthma a couple of days ago after attending emergency department, and they have given some symptoms of the child, right? Difficulty breathing and wheezing. This is a follow-up appointment. Now, patient attended emergency department 2 days back. And now this is a local clinic where the patient will come for the first time with the parent, and although this is follow-up appointment. So a lot of students have confusion that if you read that it is a follow-up appointment, that means you know the parent or the patient. Okay, but you need to read carefully and try to understand that this is the first appointment, first follow-up appointment with this parent. The child is not present for the discussion, so this is given to clarify that you are talking to the parent, okay, not the child. Now, the first bullet point says that confirm the reason for appointment. That means the appointment has already made, and we are just confirming the reason that, hey, you are here for so and so reason. Is that right? Okay, or we may ask the patient for his or her understanding of today's appointment. The second task is, so you can see that I'm not underlining or highlighting everything. Okay, I just would prefer to underline the keywords that will help me to stay to the point. Find out how the child has been since hospital visit. So this task asks you to find out that how the child has been since the hospital visit. Okay, and you are expecting that the parent will tell you about the severity of asthma, the frequency of the attacks, and the effect of the treatment that they might be advised. So you are expecting this information, and but you are starting with the open-ended question. Okay, like how has your child been since the last hospital visit? So this is an open-ended question. You are inviting the parent to give you as much information as the parent can. And if any one of these information missing, then you can ask a particular close-ended question. Okay. Now let's move to the next point. Find out further relevant details. So here you are trying to ask some more questions to the parent. Okay. That is about the family history of asthma, eczema, hay fever. Explore possible triggers of child's asthma attack. So you are trying to identify that why, okay, the child came across this episode of asthma. So you are trying to identify the allergens here. You can see that the exposure to cigarette smoke, dust mites, pollen, exercise, cold air. So you will ask questions on these triggers. Okay. Give information about childhood asthma. So here you can see that here the information gathering ends. And this is the time where you should actually summarize the information. Okay, whatever information you have collected, that you may repeat. Okay, you may say something like, okay, let me get you. You said blah blah blah. Is that all correct? Okay, so you are trying to make sure that you have understood everything properly. And meanwhile, if the parent says that no, no, I said this, not that, you may simply say that, okay, it's noted. Okay, fine. So after summarizing, you will start giving the information on childhood asthma. But always ask the parent that what do you know about childhood asthma? Okay, so we are trying to understand the parent's perspective towards asthma here. Okay, and then you may give the information about asthma that it's a chronic lung condition, and whatever information you have given or whatever knowledge you have on childhood asthma, you can give to the parent. Then you have find out any other concerns. Okay, any other concerns. So if it is particularly given like this, okay, find out any concerns, then definitely the parent will have the concern, and the concern will be related to your next bullet point. So here you are reassuring the parent about child's asthma. So it is given, the bracket information says that it is manageable, regular monitoring and support available. So probably we are expecting here that the mother will ask you that whether it is manageable or not. Okay, whether it requires regular monitoring and support. So something related to this point. Okay, the parent will show the concern when you are asking for the consent. Okay, describe asthma management. So this is about management, how to manage asthma, so that you are going to give information about. Okay, identifying and controlling triggers, assessing severity of symptoms, knowing how to respond in urgent situation, and informing child's goal. Okay, so this is the information that we will give to the parent. Now, outline next steps. So, you are just outlining next steps. It is not you are doing, you are showing that we are going to take these steps now. Okay, so you are just explaining that these are the steps that we will be taking. So, first of all, I will examine your child, then we can create asthma action plan. I will discuss the treatment options with you, and if needed, we can organize support groups, okay, or some support systems, and we will also arrange follow-up appointments to see how your child has been doing. Okay, so this is what you can just outline. Okay, and then establish parents' willingness to bring child into room for the examination. So here you are asking permission from the parent that will you please bring your child in for the examination. Okay, so this is how you are going to communicate. So when you are preparing for the communication, you can underline the keywords, and a lot of official videos I have seen where they give more emphasis on the verbs like confirm, find out, explore, okay, give information. Absolutely, I agree that these all imperative verbs are really important. However, like confirm, what to confirm in my perspective is more important. So, suppose if I am communicating and I am communicating on child's how the child has been doing since the hospital visit. And if suddenly the mother explains about the triggers, I will be able to understand that, okay, the interlocutor has jumped from this point to that point. So I will be able to connect if I have just underlined the main point of each bullet point or even each sentence. Okay, I always say to my students that consider each and every sentence as a different bullet point. Okay, because sometimes under one bullet point there are two, three different topics. Okay, so always consider each sentence as a different bullet. Okay, as a different task, or I would say. Okay, so now before I start speaking, before my speaking time starts, I would always think that how I'm going to start the conversation. Okay, because sometimes we get so engaged in preparation that when the interlocutor tells you to start, you actually get stuck. Okay, so that should not happen, and that's why it is important that we think prior to speaking. So we can understand that this is the first interaction, so we can definitely introduce ourselves and we may move to our first bullet point smoothly, right? We can also connect some background information about the child's visit to the emergency department, okay, with so and so complaints, and then we can bring the parent to the point on confirming the reason. Something like what you can start with is, hello, I'm Dr. Kirti here on duty today, and I understand that your son was diagnosed with asthma a couple of days ago at the emergency department when you presented him with the severe bout of coughing, breathing difficulty, and wheezing, right? And this is the follow-up appointment just to see that how he has been doing. Is that all correct? Okay. Here, I always get one question that whether I should ask the name to the parent. Should I ask the name of the boy? Well, it depends on you. Okay, if you want to utilize that name, that yes, sure. But you are confirming the appointment. So I believe that the appointment has been already made in advance. So, like as a doctor, you know that, okay, this patient is going to come at 4 o'clock. Okay, so you know the patient by name, even if you are meeting for the first time. So it is better that you just confirm the patient's or the parent's identity. Um, you know, if you think that you are going to utilize it. Okay, I don't think so there is any need to ask boy's name or the son's name because we don't use it. Generally, we try to complete it with by your son, by addressing like your son, your boy, okay, your child. So that is, I think more creates more connectivity. So, and we don't want to, get engaged in just recognizing the names and utilizing it here and there. No, it is not required ideally. Okay, so in this case, again, another way of starting is my name is Dr. Kirti and I'm on duty today. I'll be looking after your son. You are Ravin, is that right? Okay, so Ravin, so you may ask the interlocutor in advance during your preparation time that how may I address you during the role play, and I'm assuming that the interlocutor said that you can call me Ravin. Okay, so here you can use that name then just to confirm that you are Ravin. Okay, is that right? So Ravin says that, okay. So Ravin, what I have understood from your son's case note is that he was diagnosed with asthma 2 days back at the emergency department because he had complaints of severe bout of coughing, breathing difficulty, and wheezing. Yes, and this is the follow-up appointment after his diagnosis of asthma. Am I right? So here you are confirming the reason. Another way to confirm the reason is my name is Dr. Kirti and I would like to know what you have understood about today's appointment. This is an open-ended question. You are inviting the parent to tell you what happened with the child, and this is the follow-up appointment. Okay, so it's totally up to you and the given scenario that how you feel comfortable to begin. Okay, then suppose the parent says, yes, I'm here for the same reason. Okay, so before I proceed, could you please tell me how your son has been since your last hospital visit? So now you're expecting that the parent will tell you something like, my son's asthma hasn't been too bad. He has had one attack since he was diagnosed at the emergency department. Okay, so we have got true information that he had one episode of asthma and it was not that severe. Okay, his condition is not too bad. That means it is stable. Okay, now we have not received any information about effect of treatment, and here I can raise the question on that. Okay, I may say that, okay, that sounds good that he had only one episode and it was not too bad. But what did you do when he experienced that attack? Okay, now she or he may say that he used the inhaler and the spacer that were given to him at the hospital. Okay, that's fantastic. And do you think that it was effective? Yes, it seemed to help his symptoms. Okay, that's really nice. But I would like to ask you a few further relevant details. Is that okay? Fine. Do you have any family history of allergic conditions like asthma, hay fever, or eczema? So you are now expecting that the parent will say yes or no. Okay. So here the parent says that no one in my family has asthma or eczema, but I usually get mild hay fever in summer. Okay. So you are saying that, okay, I got your point. Now, do you think there is anything that seems to bring the episode on, like any cigarette smoke or dust mites or pollens, or if he does any kind of exercises or when he gets exposed to the cold air? So, do you think anything is responsible to bring the episode on? Okay. Now she says that no one in my house smokes and I usually keep it really clean. I think he has attacks after he has been running about outside. Okay, then probably he gets this episode after exercise, as you said, that he was running outside, or exposure to cold air, or even pollens. But don't worry, we will try to, confirm the allergens. Now, let me just get you whatever you say. Okay, your son was diagnosed with asthma a couple of days ago with at the emergency department, and today you have given me the information that he had one episode after his hospital visit. It wasn't that severe, and the treatment was effective. You get hay fever in summer, but apart from that, there is no any family history of any other allergic conditions. We suspect that your child has allergens of pollens, exercise, or cold air. Is that all correct? Well, now, before I explain you about childhood asthma, I would like to know that what do you know about childhood asthma? Now, the parent may have some information, may not have. Okay, so you listen carefully, and if the parent gives you some information which is correct, you may appreciate, or if the information is incorrect, you may just correct it politely. Okay, or sometimes the parent may say that no, I don't have any idea about childhood asthma. This is the first time that I am experiencing this. Okay, try not to worry. Let me tell you that asthma is a kind of disease which relates to the chronic lung condition. It causes tightening or narrowing of the muscles in the airways, resulting into swelling or inflammation. As a result, it secretes excessive mucus. Okay, and this the responsible factor for this is family history of hay fever, and you already admitted that you have a family history, like your son has a family history of hay fever because you suffer from hay fever in summer sometimes, right? So I hope you are clear about childhood asthma. Are you? Okay. Do you have any other concerns? Okay, ask politely, and we are expecting concern here. Okay, so say you found the diagnosis really overwhelming. I'm not sure how I'm going to be able to help him manage his asthma. Okay, so as a parent, they're always worried about the child, right? So even if it is not written in your task that empathize with the parent, it is always better to empathize whenever someone shows you any negative reaction. Okay, so here we can see that the mother says that the diagnosis came as overwhelming and she's not sure how she's going to manage his son's asthma. So you may say that, of course, your concerns are absolutely reasonable, but try not to worry because asthma is a manageable condition. However, it requires regular monitoring and support. Okay, let me tell you how asthma is managed. First of all, we really need to identify the triggers and try to avoid the exposure to the triggers. Okay, that means we need to control it. If the asthma attack occurs, then you need to assess the severity of the symptoms and you should be aware in advance how to respond in urgent situations. Okay, so being aware in advance will help you to have the prompt action in emergency. It is also advisable to inform your son's school so that they can make arrangements if he gets any episode during the school hours. Are you clear about the asthma management plan? How do you feel about managing your child's asthma now? Do you feel confident? Okay. Now, let me tell you what next steps we are going to take. First of all, I'll examine your son. Based on my examination, we will create asthma action plan and I will discuss the treatment options with you. If you require, we can connect you with the asthma support groups and we can also arrange follow-up appointments to see how your son is doing with asthma. Does it sound good? Are you clear about the next steps? Okay. So here you can see that the parent says that I feel a bit more reassured about managing my son's asthma now. So you may appreciate that. Okay, that really sounds good. So now will you please bring your child in to this room for the examination? Okay, or will you please bring your child in for the examination? Sure, I'll just go and get my son so that he can be examined. That sounds really good. Please bring your child here for the examination and we will continue the further treatment. Okay. So there, I believe that your 5 minutes will be over. Okay. If it is not, then you may just summarize the information. Okay, and while summarizing, don't go in detail because this is not the ideal place to summarize. I have already told you that you have to summarize when you finish gathering the information. Ideally, not at the end. At the end, you can summarize only you if you have a spare amount of time that you need to utilize somehow. Okay, or the interlocutor will stop you at the end of 5 minutes. This is the end of 5 minutes. Okay, so I hope you are now clear about how to communicate on this task. And if you have any doubt, please write down into the comment box below. And if you want um, the script of this task, then you will have to write your email ID into the comment box below and we will drop the transcript of this task to you. Okay, I hope you have enjoyed this video. If you like this video, please give like and subscribe button so that you will be the first to know when I upload something new. See you in the next video. Bye bye.